Dr. Morales, do I have to have general anesthesia to have surgery? The honest answer is typically yes. In my hands, most of my, I would say 99% of my cosmetic procedures I offer are going to be under general anesthesia. I feel it's safer and get a better outcome. It's quicker. The safety associated with general anesthesia is very high. We have great outcomes, really low complications associated with general anesthesia. But unfortunately, a lot of women and men are scared of general anesthesia, and they have this stigma about it, and they're just terrified of not being in control. And then they choose surgeons who perform awake, we call awake surgeries or Twilight surgery. Basically, you're getting some kind of IV medication to kind of make you a little sleepy, but you're awake. It's not uncommon to hear of the surgeons doing liposuction, sometimes breast augmentation. I would say from my observations that the stories I've had from patients who've had that surgery typically say it's very uncomfortable. They remember it. They remember, oh, I was awake, it hurt, blah, blah, yeah. Because you're awake. You had someone just go to town on you with liposuction. Of course you're going to feel it, and of course you remember some of it because you're not asleep. So, and if anybody's ever seen liposuction, it is very violent. It's not fun. It's not comfortable. It can be dangerous in some positions and in some parts of the body. You really want someone still that's not moving and flinching. But there are surgeons who are very experienced with it, and they feel they can get safe outcomes. And so, if you choose to go that route and you find that surgeon is like, I only want to use local anesthesia, you're not going to be asleep, and they try to promote safety with it, just put them to the test. Make sure they're experienced, make sure they get good outcomes, make sure they have safe outcomes. Ask them what their last complication was associated with surgery you're interested in doing. That's a very important question they need to be able to answer. But again, for me, it comes down to safety. We want to give safe outcomes where we decrease the risk associated to, the procedure itself, because again, it's surgery. So don't forget to talk with your surgeon of what type of anesthesia you're going to get for your procedure and what you're considering. And always go to a board certified plastic surgeon to have options for yourself. So thanks again for following. I appreciate your comments, and stay tuned for more.